All right, everybody. I'm here with the Dr. Morgan Carlson in his office. If you've ever been in Cache Valley and you don't know him, your parents probably do. Is that right?
Absolutely.
All right. So we're talking with Dr. Carlson today about acupuncture. It's something that he knows very well, that he loves, and he's done forever. So tell us, what is acupuncture?
Acupuncture is the use of needling in order to stimulate growth, repair, and healing in the body. Yeah.
Pretty simple.
Pretty simple.
So how does it work?
You put a needle in and it stimulates the body's immune system to send tissue repair and to send other biochemicals to the body in order to repair.
Okay.
We need to review that. We could do that again. You got to start it over.
No, we're live. This is going live. Anybody can pick it up and watch us.
And I should have thought about these questions more.
That's all right. What else would you say about it?
How detailed do you want me to get?
I don't care.
I got a sliver in my finger.
There you go.
I took
That's
my
good.
teeth and I pulled the sliver out, and it got infected. And when that happened, my thymus gland sent killer B, killer T cells, and battled. And it battled the wood and the dirt that was in there, and the germs that were introduced into my body. And the white blood cells are demarginated from the arterial walls, and they come in and battled, and antigen antibody reaction took place. And it took about a week and a half, and the infection was cured, and of course other things came in that actually stimulated growth and repair of the damaged tissue. Whenever you put an acupuncture in, you're literally stimulating this process of the immune system. It's called the chemotaxis stimulus of healing. To anywhere I put an acupuncture needle, you're going to get a reaction of killer B, killer T cells, white blood cell reaction, a tissue repair, antigen antibody reaction to stimulate growth, repair, and healing. So that is called surround the dragon, or you can take acupuncture needles and put it anywhere you want in the body just to stimulate repair at that particular point in the body. However, that does not explain meridian healing. The acupuncture is made up of 12 different meridians, and besides the front conception vessels and the back, what's called shoe points, and these also can be used in order to stimulate growth, repair, and healing. All the meridians are balanced with a particular organ like kidney, heart, lung, digestion, liver, etc. And so you can actually use the energy of these different organs to stimulate balance in the body, or repair of a kidney, or repair of a heart, or use these meridian balancings to repair things like headaches or pregnancy problems, of morning sickness, etc. You can virtually use acupuncture to treat pretty much anything in the body.
That's amazing. So what we're saying with the pain points that you were first speaking about is pretty much that we're just stimulating the body's immune system to respond.
Yep.
But we're not introducing the body with anything that would actually be toxic to it at the same time, so it's completely safe.
There's virtually no risk associated with acupuncture unless you consider that putting a needle in that might cause discomfort or bruise. Other than that, there is no risk. Even if you put an acupuncture needle into a nerve, it will not damage the nerve. Whereas if you put a large needle like with cortisone into a nerve, it'll kill it, but acupuncture will not. But you will give the patient a shot or a jolt, and you'll obviously take it out, but there will be no lasting damage to the nerve. Acupuncture is pretty much painless. The only place you feel pain with acupuncture is just breaking the skin. And so if you break the skin very quickly, and so I use an acupuncture tube, which is a plastic tube, and I place this tube on the patient's skin with a needle in it. Right here, I place this plastic tube on the skin with a needle in it, so it sticks up about 1/4 of an inch, and then I tap the needle in and it goes in. The needle itself is so small that it does not damage any tissue, and yet once it goes inside the body reads it as a foreign material, causing the body's immune system to respond. And when the body, when this chemotaxis stimulus of healing of killer B and killer T cells gets to where the needle is, the needles are sterile, so they introduce no bacteria, and they're so small they don't damage any tissue. So the chemotaxis stimulus of healing and repair, there's nothing to fix except for what's already there. So it's just a way I can stimulate growth, repair, and healing anywhere I want by putting a needle in to stimulate the body's reaction to heal.
And if you come in today, you can have that same needle that was in his body, and we'll put it in yours. Just kidding.
No, the needles are used one time and we throw them away.
Oh, okay. Good. That's good. So, acupuncture's been around for a long time, right? How long?
I don't know. Thousands of years.
Awesome. So there must
Nobody
be
really
something to
knows.
it.
Well, it works for me. I've
Yeah.
had a lot of patients get incredible results who don't get results anywhere else.
That's right. So, what do you find acupuncture to be the most beneficial for?
Health.
Beautiful.
There you go.
I love it. So, what should somebody do in preparation for or after acupuncture is finished?
There is no preparation before or after. You can come in under any way or any condition with a migraine headache, with nausea, with throwing up, with whatever, any kind of headache, pain, or whatever. You can come in, and after it's over, no, you basically want to take a chill pill, enjoy the energy that's been given, and the health that you're feeling.
Awesome.
So it's more of just a relaxation thing that you can leave feeling better than you came.
Now, we do two main types of acupuncture here. I know that I'm probably saying that wrong, but you were explaining to me that there's a hot acupuncture and a cold acupuncture, and we do both of those here. Do you want to just say a little bit about that?
I look at a patient's tongue, and if the patient's tongue is hot looking, if it is red, has a yellow coat, shriveled up, dry, then I cannot use a hot pattern, which is called yang energy. In that case, I will use a cold pattern and add yin energy to the patient. If I look at a patient's tongue and it is damp, pale, swollen, then it needs hot or yang energy. And then I will use fire on the patient called moxa. Moxa is placed on top of the needle. The needle is coiled. Moxa burns at exactly 8 hertz, which is the exact same frequency that gravity runs at, is 8 hertz. So therefore, we can stimulate, that's the primary energy of yang energy, is to add the original energy into our body. Our bodies, when they're healthy, run at 8 hertz. When they are inflamed or hurt, the energy, the frequency can rise as high as 200 hertz, and this will take you back to 8.
Absolutely. Okay.
So,
All right. So I've got a poll up here to ask people what kind of acupuncture they like the most, if it's the cold or the hot with moxibustion. That's the when you're in the office and you're having this done, that's the smell that you have that smells like weed. We unfortunately we don't have weed here. We do offer some CBD oil, but and the moxibustion, but both of those aren't the actual plant product. Yeah, that's right. All right. So if you have any other questions about acupuncture, please comment on this video. Let us know, and we will be sure to post some follow-up comments if you have any. Thank you,
Doc. Thank you for doing that.
Thank you.
All right.
We'll try and do more of these.
So that's going online?